Hey, Internet. It's Dr. Nan here. And I didn't think I was going to be doing another coronavirus report quite this soon, but things change. So here we are, mid-June, 2020, and cases are going up, mask use is going down. We all know this. There's no point in hashing it out again. We're not going to convince anyone to change their mind about whether or not to use a mask. But something happened this week that I thought I really needed to share. Okay, so we know the cases are going up. We know what the timing of it is. Some people are going to blame the partiers over Memorial Day weekend. Some people are going to blame the protesters. Bottom line is that it's some of both, and we'll never know how much of it was one versus the other. And honestly, it doesn't really matter. What matters is how we're going to deal with it. Cases have gone way up in the state of Arizona, and that brings something to mind that I hadn't thought about until I returned to the hospital this week, and that's snowbirds. The snowbirds were down in Arizona and Florida and several other warm, beautiful, wonderful states during the shutdown. The shutdown is over. Those snowbirds are going to do what? They're going to move back up to the cooler states. And those of us who work in those cooler states or in those mountainous regions are seeing that now. So I wanted to get online and warn my fellow healthcare workers and employees that, if you work in one of those states that's not hitting triple digits, you're probably going to see some of these people coming back into your area, back into your hospitals, and they're going to bring COVID-19 with them. The SARS-CoV-2 virus is out there, and as these people migrate back north, they're going to be bringing it with them. So please be prepared for that. Make your staff aware. Start changing some of the questions that you're asking or pinpointing some of those questions, and be a little more cautious about that. We have had 2 definite cases in our hospital just in the past week, and a third possible case. The good thing about this is that we learned the rapid test can actually pick up cases. Prior to this, the rapid test had been negative all the time, but we actually had a couple positives. But more importantly, all of our screening systems worked, and everything's going to be okay. But this brings to light a whole new problem that we had not been on the lookout for previously. So keep the snowbirds in mind. So even if people don't go out and travel for vacations, they may be just doing their normal biannual migrations. So there's that. Just one more thing to watch for. If you can encourage family and friends to start wearing masks again, that would be fantastic. We do know that masking helps. We do know that not testing isn't going to give us a true number of who has and does not have the virus. And I don't believe we're really out of the first wave. So hang in there, folks. The ride's not over. As always, if you have questions, drop them below, and I'll answer as many as I possibly can. Thank you very much.